Do you have pain on the inside of your elbow that increases with gripping movements and also wrist extension? If you do, you might have figured out you have medial epicondylitis or golfer's elbow. This video is for people who know they have golfer's elbow or simply tendinitis of the wrist flexor or medial epicondylitis. In this video, I'm going to show you exercises for this condition. The timestamp is in the description, so if you want to skip ahead, you can. I'm not going to explain the anatomy of this condition like many other videos do, but if you're interested in the elbow anatomy, you can check out the anatomy lesson from Mr. Physio about this condition. The link is in the description. In this video, I have analyzed and categorized all the physical therapy exercises for golfer's elbow that have been mentioned across 13 of the most popular physical therapy YouTube channels. I have categorized these exercises into 4 different categories, and I have a list here. There are 4 categories of exercises that have been recommended for golfer's elbow: massage for the forearm, flexibility exercises for the wrist and forearm, strengthening exercises for the wrist and forearm, and strengthening exercises for the shoulder. Category 1, massage. 8 of the 13 channels recommended some type of soft tissue mobilization or massage for the affected arm. 4 of the 8 recommended cross-friction massage, and another 4 of the 8 also recommended functional mobilization to release tension in the medial epicondyle. 3 of the 8 recommended using a ball to massage the medial forearm. I thought it was interesting that rehab science actually discouraged the practice of rolling the arm over the ball that the other 2 channels recommended, and rehab science seemed to recommend the use of the ball as a tool for myofascial release instead, without rolling the arm over the ball. Personally, I don't like the idea of rolling sensitive muscles and tendons over a hard object. I prefer using my hands instead so I can adjust the pressure according to the sensitivity of the arm. Dr. Christianus recommended the use of an edge massage tool to mobilize the fascia of the medial epicondyle. Category 2, flexibility exercises. 7 of the 13 channels recommended some type of flexibility exercise for the wrist and forearm. 5 of the 7 recommended wrist extension stretch with overpressure. This is very useful to release tension in the wrist flexors. Precision movement recommended an active stretch of the wrist flexor and wrist extensors with the elbow straight. Physio tutors recommended the ulnar nerve sliders. Category 3, strengthening exercises for the wrist and forearm. 12 of the 13 channels recommended some type of strengthening for the wrist and forearm. 7 of the 12 recommended concentric strengthening of the wrist flexors. 6 of the 12 recommended eccentric strengthening of the wrist flexors. Eight of the 12 recommended strengthening of the forearm pronator muscle. Category 4, strengthening exercises for the shoulder. 4 of the 13 channels recommended strengthening of the shoulder muscles. These can be further divided into shoulder external rotator strengthening, shoulder abductor strengthening, shoulder extensor strengthening, and scapular strengthening. Management of the acute phase when the elbow is inflamed. Bob and Brad and Tong and Titan recommend the use of an ice pack and an ice massage technique for the inflamed medial epicondyle. Bob and Brad and Ask Dr. Joe also recommended the use of an elbow brace. Tong and Titan also recommended taking prescribed anti-inflammatory medication. And lastly, Bob and Brad recommended kinesiotaping. highly recommend you seek out a local physical therapist or physiotherapist to go over these exercises with you. That way, they can tailor the program according to where you are in your injury. Personally, when I prescribe exercises and I see that the patient is in a lot of pain, in the phase of acute phase, and their tendon is inflamed, I tend to give exercises that are more gentle range of motion exercises without too much overpressure, minimal strengthening. I may actually wait for the inflammation to go down, just concentrating on icing, maybe a little kinesiotaping to calm the inflammation, and some gentle stretching for about a week. And when the inflammation has gone down and the pain has decreased a little bit, then we can go into more strengthening. Strengthening is important because usually with an injury like this, you'll have decreased strength in your hand and your arm. We want to return the strength back to normal, and with that, we need some degree of strengthening.